Good morning. We are going to start the lecture series on the musculoskeletal rehab by first delving into bone physiology and repair. And perhaps we'll touch up on the physiology of tendons, ligaments, and other soft tissues that are of importance as well. What is very important is for us to realize that although bone seems to be an inert substance, it is actually a living tissue, and we have to treat it like such. Actually, our bones are all in the process of bone turnover. That is, as we spend our days, our body is continually replacing all the bone parts in all our skeletal system. So when you're still young, when you're still skeletally immature, you're especially if you're less than 10 years old, in 1 year, your body would have replaced all your bone tissues. All your skeletal system would have been replaced by new bone and new fibers and new matrix. As you grow older, it would probably take 10 years for the body to replace all your skeletal system. So if you live around 70 years old, you would have probably replaced your body around 7 to 10 times. Now, the bone is a connective tissue, but it's unique among connective tissues because it is rigid. It is said that it has the compression strength of cast iron, which means it is very hard in compression, but is more flexible and elastic. The reason for your rigidity is the matrix, the extracellular matrix, which is your calcium hydroxyapatite. And the reason for your flexibility would be your collagen fibers that are arranged in your bone. So if you take away all the calcium hydroxyapatite crystals, your bone would become rubbery. If you take away all the collagen fibers and just retain the calcium hydroxyapatite, if you drop bone, it will probably break faster than without your collagen fibers. Now, um, in looking at the functions of bone, we are all sure about the mechanical support. We all know that, but we also have to realize the skeletal system is a very important repository or storage of certain minerals like your calcium. And whenever you think of calcium, you also think about phosphorus. And at a small extent, sodium, magnesium, and other small components, even uranium or arsenic, if somebody is slowly poisoning you. So basically, if you die of some unknown cause, your bones could be examined. And if you've been poisoned or if you've been exposed to hazardous chemicals like mercury, arsenic, uranium, they would probably find it in bone. So what is mineral homeostasis? It's for example, if you are running low on calcium, your body will take away some calcium in your bone and put it in the blood. If, for example, you ate a lot of cheese, so you have a lot of calcium in your blood, and the body doesn't know what else to do with calcium, it deposits it in your bone. Another important thing is your bone is also the only one that creates or a very important or the major producer of your blood cells, your red blood cells, your white blood cells, your um, platelets. And we'll find out later on where exactly in the bone does that happen? Of course, mechanical support, that's a given. Here is also a very important thing. It determines the attributes of size and shape. In the age of AI, we now have machines or software programs that could recognize people by looking at the bone structure underneath the skin. So even if you wear disguises, your bone structure in your face would give you away. Unless, of course, you rearrange the bones in your face. Okay, so what composes your bone? Very little cellular components and mostly your matrix, your extracellular matrix. A small part of that is your organic, which is your collagen, and your inorganic, which is your calcium hydroxyapatite crystals. For your cellular components, these are your living tissue actually. These are living cells producing or doing whatever they're designed for. When you say osteoblast, these are bone forming cells. They are very active during growth or during bone repair. Osteocytes are actually semi-retired or inactive bone cells. They're just sitting around and slowly doing maintenance work. Osteoclasts, on the other hand, are opposites of your osteoblast. Osteoclasts break down bone. When do you need to break down bone? In case of bone remodeling, or in the case where your body needs extra calcium in the blood, so the osteoclasts break down bone and extracellular matrix and release the calcium in the blood. Okay, if you look at this is your usual uh, illustration of your bone tissue. You see, this is your, if you see these small dark spaces here, these contain your osteoclast, and these osteoclasts continuously create new collagen and bring it out, and then they also help deposit um, extracellular calcium. So just to illustrate, osteoblast would be the very active bone cell creating new bone, and the osteocyte is the laid back cell where it just stays in one place and it doesn't do much except for slowly replacing old collagen and depositing hydroxyapatite crystals. Okay, for your organic components, you can see that it's mainly collagen and it is type 1. Remember that. Now, for you to never forget it, remember this. When you write bone, remember it has 1 in it. So, when you talk about bone, there's collagen type 1. And of course, you have your inorganic components, your calcium and osteocalcium phosphate. Remember, calcium, phosphate work or are hand in hand. Whenever you talk about calcium, you also have to think about phosphate. Just like when you think about sodium, you think about potassium. Okay, very important thing, circulation. Since bone is a living tissue, it needs nutrients, it needs oxygen, it needs all the things that any living tissue would need. So circulation is very important. Our skeletal system receives about 10% of the cardiac output, total cardiac output, and the way you or the way you determine whether bone will heal fast or will heal slow would depend on the circulation. So for example, if you break a bone in a part where there's rich blood supply, the bone would probably heal very fast. In a place, an example of that would be the hand. In a place where there's little or poor blood supply, like for example, near your ankle, in the distal part of your leg, if you fracture that, it would heal a little bit slower because it has lesser or a poorer blood supply. The same goes with smoking. That is why if you have a patient, you always ask for smoking history, because smoking will definitely constrict your blood vessels and impede blood supply. The same is true with alcohol intake. Not because alcohol would um, impede blood supply directly, but usually, when you're drinking alcohol, you or some of your friends are also smoking. So you have to be mindful of that. So this is your, I'll just show you this one. This is your periosteum. Okay, that's the soft tissue surrounding bone. That is very important because your periosteum is very rich in blood supply. If you don't take out the periosteum, the bone's blood supply is protected. At the same time, periosteum also contains your osteoblasts or your osteoprogenitor cells, which will later become osteoblasts. So in a fracture, if your periosteum is intact or not totally damaged, your chances of healing is good. Okay, so we go to bone types. There are two kinds of bone. Well, lamellar or woven bone. And forget about the woven bone because it's just pathologic bone. But when we talk about normal bone, you have your compact or more commonly referred to as cortical bone, and then you have your cancellous bone. So if you want to sound archaic, you speak, or you mention compact or trabecular. If you want to sound modern, it's cortical and cancellous. And what are they? Now, if you remember, when you eat your bulalo, you have this part, right? This part has all the nice, utok, all the nice bone marrow, which we all like to eat. Now, recall that the bone around this is really very strong. That's your cortical bone. As you go up here, you will find the bone here tends to look more like termite nest, and that is your cancellous bone. Okay? So the main difference is cortical bone is of course, it is very, very strong, but it has very little bone cells, so your turnover rate is slower, thus healing is slower. Cancellous bone, not as strong, but it's good for shock absorption. It has a lot of cells, just like termites in your termite nest, and so your turnover rate is higher, healing is faster. So here, this is your typical cortical bone. What you see here, this one, these are your osteons. These are your Haversian canal systems, typical of cortical bone. Okay, bone classification by shape. Um, if you look at this is the most typical. When you draw a bone, you usually draw a bone like this. This is your long bone. This one, this is usually found in your skull, in your sternum, your pelvis. These are flat bones. You have also irregular bone. Here, a bone so unusual in shape that you could not really tell what shape it is. And you have this, your sesamoid bone. Your sesamoid bone is unusual in that it is usually embedded inside a tendon. And the main purpose of your sesamoid bones is to improve your biomechanics by improving the lever arm. So your biggest sesamoid bone is in your patella. And because of that patella, or in your knee, which is the patella, and that patella actually makes your quadriceps muscle group function better as a knee extensor. Okay, along the long bone is the most common part or common bone that we can see, and it is divided into parts. This part, this long, narrow part, this is the shaft or your diaphysis. As it goes distally or proximally, it widens up. So your cortical wall here becomes less thin, less thicker, so it becomes thin, and it is gradually turned, or there's transition into cancellous bone. So the end part of your bone is called the epiphysis. The middle part, the long shaft, is your diaphysis, and then the transition zone is your metaphysis. So mostly in your diaphysis, you'd find cortical bone. In your epiphysis, it's mostly cancellous bone because it's designed to bear weight and absorb shock. And in the middle, your metaphysis, it's a combination. Your cortical bone gradually thins out, your cancellous bone gradually thickens or becomes more prominent. Okay, now let's go to your bone marrow. Your bone marrow is very fatty tissue. Of course, you also have it has a lot of progenitor cells. If you look at it, you have your red and your yellow marrow. The yellow marrow is the one we're interested in when we have your bulalo or your linaga or your kansi, because that's the yummy thing in between or inside the bone marrow. Um, that is actually inactive. It's mostly fat, and that's why it's very delicious. Red marrow is the one that creates your blood cells. And of course, next would be your periosteum, which we have already discussed. Bone formation, we'll just go through that fast. Okay, I will end the first part here. We're almost 20 minutes. Um, I will continue on the second part of the lecture. Thank you.